So moving on to serotonin syndrome, this is rare, but something that's important to know about. Usually these children will be maybe adolescents who are already on an SSRI, they have an increase in their dose in the past few days or week, or they have multiple medications. We see this more in adults. Multiple proserotonergic medications can cause this. Usually in the first 24 hours of a dose change, you'll see mental status changes, they'll be agitated, they might have clonus or rigidity, and their autonomic nervous system is hyperactive. So they may have increased temperature, your blood pressure's up, and your heart rate's up. The important things to remember for serotonin syndrome is they are hyperreflexic. And these symptoms occur pretty quickly, rapid onset within 24 hours after a change in dose. Your treatment is supportive care. You can also treat more for symptomatic management with benzodiazepines. Neuroleptic malignant syndrome, we see this more commonly as a result of antipsychotics, usually first-generation antipsychotics. But the symptoms, the reason it's next to serotonin syndrome is the symptoms are very, very similar. The difference from serotonin syndrome is at the bottom, bradyreflexia instead of hyperreflexia, and a slower onset of symptoms, so days to weeks instead of that 24 hours that we see with serotonin syndrome. The treatment of choice, and always remember this for the exam, is dantrolene for neuroleptic malignant syndrome.